How does HPV co-testing improve Pap smear accuracy? Imagine trying to catch a small leak in a pipe. Using just one method might miss it, but combining two different tools increases your chances of finding it early. That's what happens with HPV co-testing in cervical cancer screening. It combines the Pap smear, which looks at cervical cells for abnormal changes, with an HPV test that checks for high-risk types of human papillomavirus, the virus linked to most cervical cancers. This dual approach makes the screening more sensitive and reliable. Research shows that co-testing detects more cases of precancerous changes and cervical cancer than either test alone. For example, a large study involving nearly 19 million women found that HPV testing alone missed twice as many women who later developed cervical cancer compared to when both tests were used together. This means co-testing is better at catching serious issues early, especially for women aged 30 and older. The Pap test helps identify abnormal cell changes, which could be caused by HPV. The HPV test detects whether high-risk virus types are present, even if there are no visible cell changes. When combined, these tests reduce the chance of false negatives, meaning fewer cases of disease are missed. While co-testing can lead to more false positives and more follow-up procedures like colposcopies, this is a small trade-off for the benefit of catching more serious problems early. In practical terms, if a woman tests positive for high-risk HPV but has a normal Pap smear, she can be monitored more closely. If her Pap shows abnormalities, she can be referred for further testing right away. This personalized approach helps ensure that women receive timely care and reduces unnecessary procedures for those at lower risk. For cervical cancer screening, especially for women aged 30 to 65, current guidelines recommend co-testing every 5 years. This interval balances the benefits of early detection with the goal of minimizing unnecessary interventions. Overall, HPV co-testing improves the accuracy of Pap smear screening by combining cell analysis with virus detection, leading to earlier diagnosis, better management, and ultimately, better outcomes for women. Remember, always consult your healthcare provider for personalized advice and screening plans.